Good morning. Today we will be discussing on the topic maxillary major connector. So coming to the components of cast partial denture, each components have its own specific function, and the name of the components will be same for both the maxillary and mandibular arches. So coming to the definition, it is that part of the removable partial denture connect the components of one side to that of the opposite side. So all the components are connected to the major connector directly or indirectly. There are some requirements for the removable partial denture. First of all, it should be rigid. It should provide some kind of vertical support. Indirect retention should be there, and it should not impinge on the soft tissue, gingival margin, and it should be parallel to the gingival margin. So in this picture, it's shown that the blue arrow indicating that there should be a gap of 6 mm from the gingival margin to the edge of the major connector, and it should always parallel to the gingival margin and should follow the contour of the gingival margin, and it should be able to self-cleansing, and it should not cause any kind of disturbance for the patient. It should not affect the phonetics of the patient. So coming to the next thing, that is the beading. Always the maxillary major connector should have beading in the posterior edge, so that it will the soft tissue as well as the process will have a close contact, which will prevent the food entrapment under the denture base. Next one is relief. This will be given in certain clinical situation where if there is a large torrent or bony prominence is there in the palatal region, we should always select the major connector according to that. Coming to different types of maxillary major connector, there are of 6 types. So first one is the palatal bar, palatal strap, anteroposterior palatal bar, horseshoe shape, closed horseshoe type, then complete palate type. Coming to the first one, this is the palatal bar, which is a bar running across the palate, and it is half oval in shape with the thinnest point is at the center. So indications are that it's used in interim processes, and it is used in the class 3 situation where there is minimum number of tooth have to be replaced. Coming to the disadvantage, as the diameter, anteroposterior diameter is less, the support from the palate will be less. So the support, it should depend on the support from by the rest on the remaining teeth. And the other disadvantage is that the patient will be having a discomfort because of the bulky processes at the present at the running across the palate. And it should not be placed further anterior to the second premolar, as it will cause interference to the tongue, and it should not be used in the case of class 4 distal extension case. Coming to the next one, that is the palatal strap. In case of palatal strap, it's similar to that of palatal bar, but the width is more. It is of 8 mm width. A thin strap is crossing across the palate. So it is a versatile major connector, and it is indicated in the case where there is a class 3 situation with a short span, class 3 situation, and in class 2 situation. So this is the picture of palatal strap, which is running across the palate, and it's of 8 mm diameter. And it has got many advantages, like as it is extending in the 3 planes, it can resist the bending and twisting forces, and it will provide some amount of rigidity with less bulk of metal, and it will be comfortable for the patient. And as it is a thin layer of metal that is coming in contact with the soft tissue, there will be retention gained by addition and cohesion, and also it will contribute to some kind of indirect retention also. So coming to the disadvantage, as the area of distribution is more for the palatal strap, so there will be papillary hyperplasia, and the patient can complains of excessive coverage of the palatal region, and there will be If there is a torrey or prominence in the mid-palatine region, this kind of a major connector will cause discomfort for the patient. Coming to the anteroposterior or double palatal bar. It's two palatal bar anteriorly and posteriorly, which will be connected by a longitudinal element on the lateral slopes of the palate. So if the anterior bar is somewhat narrow, just like a palatal strap, but the diameter will be less, and the posterior bar is similar to a palatal bar itself. And always we should make sure that the anterior bar will follow the rugae values of the rugae rather than giving it should the border should end in the values of rugae. For the this will avoid the discomfort to the patient. So coming to the in this picture, it shows the anterior palatal bar with an increased diameter. This is the palatal bar posteriorly, and this is connected by two longitudinal elements on the lateral slopes of the palate. So coming to the indication, it is indicated in the case where there is a torrey is present. It is used in class 2 and class 4 situation. And the patient who complain large coverage of the palatal region, this kind of a major connector can be given. And if anterior and posterior abutment are widely separated, we can give this. So coming to the advantage, it will provide excellent rigidity and with a limited coverage of tissue, and an L-beam effect will be there. What is an L-beam effect? So the two palatal bars are running in two different planes, which will produce extremely good rigidity to the prosthesis. Coming to the disadvantage, the palatal coverage is less, so the support gain from the palate is less, and multiple borders of this processes can cause discomfort for the patient, and it cannot be used in the case of high palatal arch or in a narrow palatal vault. Coming to the horseshoe or U-shaped connector, it is a thin band of metal that is running along the lingual surface of the posterior tooth. Anteriorly, it covers the cingulum and posteriorly extends to 6 to 8 mm to the palatal tissue. So this is the palatal strap, which will run along the up to the cingulum in the anterior region, and it extends 6 to 8 mm to the palatal surface. It is used in class 4 situation, and if the patient is having torrey, we can use such kind of a major connector. If there is increased vertical overlap of the anterior teeth, and if we need to stabilize the anterior teeth, in all this clinical situation, we can give a horseshoe type of connector. Coming to the advantage, it's strong, and it will give some amount of vertical support and indirect retention from the palate. Disadvantage, again, there is less resistance to the flexing movement, so it cannot be used in the distal extension base for providing cross-arch stabilization. And if we are giving greater bulk in the anterior region to avoid the flexing movement, this will interfere with the this will affect the phonetics of the patient, which will cause discomfort for the patient. Coming to the closed horseshoe or anteroposterior palatal strap. This is similar to anteroposterior palatal bar. Two palatal straps are running anteriorly and posteriorly, and they are connected by a longitudinal element on the lateral slopes of palate. So basically, this edges should 6 mm away from that of the gingival margin, and the inner diameter should be 20 into 15 mm, and always if we are extending into the rugae region, that should be in the value of rugae. So indicated if there is multiple tooth are missing, and if we need to replace it, and if torrey is present, we can give such kind of a major connector in class 2, class 1 situation. Advantage, will provide good palatal support. It will produce an L-beam effect, rigidity with less thickness of the metal. As two bars are lying in different planes, that will give an excellent rigidity for the processes. That is the L-beam effect. Coming to the disadvantage, interference with the phonetics of the patient, which will cause discomfort for the patient. Coming to the complete palate type, a uniform metal coverage extend over the entire palate. It replicate that of the anatomical. It will be simulate the anatomic replica of the hard palate. So this is the complete palatal type of major connector, which extend all around the palatal surface. So it is used in class 1 situation and anterior class 1 anterior and posterior modification spaces. And if there is a shallow palatal vault is there, we can use this major connector. In cleft palate patient, we can use this major connector. Coming to the advantage, it has got excellent rigidity, support, and stability. Coming to the disadvantage, because of the excessive coverage, there can be cause tissue reactions can be occur, and the patient phonetics will be get affected. This is the now we summarize the major connectors in maxilla. For a class 1 situation, we use closed horseshoe and complete palate type. For a class 2 type, palatal strap and closed horseshoe. For a class 3, palatal strap and palatal bar. Class 4, horseshoe, closed horseshoe, and complete palate type. So that about the different types of major connectors in maxilla. And based on the clinical situation, we should be able to identify which will be the perfect major connector for particular case. We should design the removable partial denture according to that. Hope you all understand. Thank you.